and you are the one of those organizations who have kept yourselves as specialist, not journalist. We have seen a trend of community service organizations going from one to multiple funding programs in order to, one is, yes, they had the skill set, and second one was sustainability story around it. And in those scenarios, when you are working on bids and projects, you are multi-program organization. When you're working in collaboration, how do you align the purpose there?
There's a number of layers. Yeah, so I mean, look, you need to have organisations that align, but then when I drill down to what that means is you need to have a culture that's similar amongst your staff and around how you care for individuals. But what is also really important is the relationships you have between the CEOs and the executives, because it's very easy to sit around a table and have some blue sky thinking about how good a service could be and to reach alignment there. But things don't always go to plan, and you need to think about what would it be like if we had some problems or some challenges and the rubber hits the road and we're working with these teams. That's when you're going to find out how well aligned your values are. So what I find with these things is it's important to have ongoing relationships with other partners during the year, because if you get 6 or 7 weeks to respond to a tender, there's no way that you can determine in that shorter period of time, just approaching a new agency and trying to work out if you work well. We started with organisations that we naturally connect with in terms of clients who we might both be supporting. But with some of our key partners, we have times where their executive comes and has lunch with our executive just for no real agenda, just to meet and greet and just build the relationships, because I find that you really need those things to work together. So it's about having an ongoing relationship, and also for the long term. So some of our key partner agencies we've been partnering with for 5, 6, 7 years, and that's what you really need to start embedding similarities and to know where you work together and how you work well. So you need to have a long-term approach with these things.
And can you, because mental health has become front and center for the last few years, and I don't want to battle down on COVID again, but what do you think where the sector is going? And are there opportunities of having a similar model as NDIS or aged care, where everybody who would need some form of mental health can look for providers to get that, not extreme. So you do, residential, that is one of the extreme end of the mental health, but there are more light supports, early end of the spectrum. So do you think, is that happening in the sector, and what do you feel as a viewer?
Yeah, cool. That's lots of parts of that question. So, look, I would be very nervous if we had any more encroachment of the NDIS onto mental health, because I think the NDIS is pretty dysfunctional and there are so many problems with it. So I'm convinced that it's very hard to provide good quality and good safety of care for people with mental health as a primary diagnosis under SIL. There's a lot to be changed and addressed in that space. I think if we look at the other end of the spectrum, it would be really fantastic if there was more funding for early intervention services for people in the community. So for people who had their first experience of anxiety or depression, for example, it's challenging. You've got to go to a doctor for have a longer session, then you need to get then you have your funding, which covers part of your sessions with your psychologist or counsellor. That's a few barriers really to go to access the service. I would be a really big fan of, in the same way that you can go to your GP and there's immediately Medicare funding for that, and in many instances you can get bulk billed. I wish the same existed for dentists and for going to psychologists and counsellors. And I guess it's the physio in me who also is very well aware of the oral health has a very strong link to other forms of healthcare and your overall health outcomes. So I thought I'd throw that in as well. But gee, wouldn't it be great if an individual of their own volition who knows they need some services from a psychologist or a counsellor could just go to those services without having to go to the GP, pay a gap there, and without having to get a care plan, all these things. I just think that's a barrier. And I think also at the cost that is charged to Medicare for some of the GP mental health plans, and then having to go back to the doctor, I just think, why can't we just go directly to a psychologist?